You know, these days it's all too easy to jump on our phones and start searching the web for statistics and opinions on a very complex topic. And if you factor in the advancements of AI, it's never been faster or easier to access information.
But there are those of us who have a few more years under our belts who would prefer to sit down face to face with another human and get all the facts straight. Well, that is exactly what the Delaware Department of Insurance Medicare Assistance Bureau is all about.
That's right, and we are here today with Trinidad Navarro, the Delaware Insurance Commissioner. He's alongside Lakia Turner. She's the Director of the Delaware Medical Assistance Bureau. Welcome to Historic Studio D, both of you.
Thank you for having us.
Yeah, so we're going to talk all about Medicare and everything, but as we like to do, we like to get to know our guests a little bit. So how did you get into insurance?
Well, it's a long story. I don't think I can cover that in
Okay.
4 minutes. And I've been in public service my whole life, so I'm fortunate to be in my third term now as insurance commissioner. I love what I do. We help people every single day.
Yeah. How about you, Lakia?
So I've been with the department probably for the last 25 years, serving Delaware's Medicare population.
Wow.
So how did the Bureau itself get started?
Well, it's about a 30-year journey. I mean, this is a federally funded program. We help people sign up for Medicare when they turn 65, and we also help people year by year, where people actually come back almost like a family. And because their co-pays change, their deductibles change, it's very complex. And that's why it's so important to have staff like Ms. Lakia, who's been around a long time, who's helped thousands of people over the years and saved consumers millions of dollars.
What is it about Medicare that makes it so confusing?
There's different parts of Medicare, and it's always changing. This year, Medicare beneficiaries will see a change in their Medicare premium. For most people, they will pay $185 per month, and they will also have an annual deductible of $257. In addition to that, there's no longer a donut hole. So Medicare beneficiaries have the option of choosing a prescription drug plan, and now they also offer a Medicare prescription drug plan payment. So because individuals have a hard time sometimes paying their premiums at the storefront, or I'm sorry, not their premiums, but paying their copays at the storefront, they actually offer where they can manage their prescription plans throughout the year so that there's not a large cost when they go to the pharmacy to pay for that. And this year they will pay a maximum out of pocket for their prescription drugs of $2,000.
Okay.
It is remarkable to me, everything that you know just off the top of your head. How do you help the beneficiaries?
Well, it's as you can see, it's very complex. And people come to us when they're turning 65. They typically have had insurance their whole life, either through their employer or through the commercial market.
Right.
And so they don't understand the complexities, right? That you have to sign up. If you don't sign up, there's a potential penalty, right? They don't understand the actual dollar amount that you have to pay. It is a really good return on investment, right? Because you're paying into it as you're working all these years. But it's something that people do have challenges with. So when they come to us, they're confused, they're upset, they really don't know what they're supposed to do. That's why it's so important that they spend the time with us. We do that with people each and every year.
Now, does your Bureau train others who might want to get involved helping people?
Absolutely. So we have a staff in our office. We have 3 locations here in the state of Delaware. But in addition to that, we have volunteers who play a vital part in our program. Without these volunteers, our program would suffer. And what happens is these individuals are out in their community and they're providing outreach and education just as the staff in our office does. We encourage individuals to make sure that while they're out there and they're volunteering, that they're educating beneficiaries that there is help to pay with their Medicare costs, because a lot of people do struggle with paying for their prescription drugs and their Medicare premiums.
Okay, so let's go back to open enrollment. Tell us about the open enrollment.
Well, folks who are turning 65, they have 3 months before their birthday and 3 months after their birthday months, and then 3 months after. Okay. And that's, as people age and turn 65 throughout the year. But open enrollment, Lakia can talk about that because she has the exact dates and times.
So we just had the annual open enrollment, which ran October 15th through December 7th. However, there is now the Medicare Advantage open enrollment, which runs January 1 through March 31st. So for anyone who had a Medicare Advantage plan, who is unhappy with their plan, and they want to make changes, they can take advantage of changing their Medicare Advantage plan until March 31st of this year.
And you can help them out if they need the help.
Absolutely. We have staff on call Monday through Friday, 8 to 4:30, who can answer their questions, who can help them with changing their plans, finding the best plan that fits their individual need. When they contact us, we would ask them to make sure that they have a list of their prescription drugs so that we can run that information into the Medicare.gov federal system. And from there, we will tell them what plans best fit their needs.
Great. Wow. Trinidad Navarro and Lakia Turner, thank you so much for being with us today.
It's our pleasure.
Thank you for having us.